I'm Dr. Deuk at the Deuk Spine Institute, here with a patient from Virginia who came out to the Deuk Spine Institute yesterday for surgery, and we fixed 2 discs in his lower back. You were having back pain for some time. Do you still have that same back pain?
No.
Gone.
I feel my back feels 100% this morning. I was able to sleep in the bed, laying flat for the first time in 2 months. I was sleeping on the couch for those 2 months, and I did not get good sleep at all. So I feel great in my back.
Good. Well, that's why we're here. We wanted to cure your back pain and give you quality of life back. What was life like living with that back pain?
Any day you'd be like, it could happen today. I could go down with back pain, severe back pain for a week. And that happened. My first pain started about 5 years ago. I was working in the flower garden. I went down with severe pain. I was down for probably a month that time. And ever since then, it was just like randomly, just out of the blue, I'd go down for another week with severe back pain. It was just no way to live because I knew every day waking up it could happen today.
Yeah, it is no way to live because then you got to be careful every day. You don't set it off. You're worried about it. You're thinking about it. It takes control of your whole life, that back pain. His back pain happened to be coming from 2 discs. And did you see any other doctors? Did they recommend treatment for you in Virginia?
Yes, I was seeing chiropractors for the first number of years. The first chiropractor, he put me on this decompression table, and he would, pull you apart. I did that for 6 weeks. I felt a little relief at first, but it didn't last very long. And I've been seeing just regular chiropractors throughout the years as well. And then when this happened, I saw an ortho doctor. He did not recommend surgery. He recommended physical therapy. He said surgery it's like a coin toss. It either works or it doesn't. And that was not good enough for me. I needed a little bit more reassurance that it's gonna work. That's when I started looking for other options. And I had a lot of time on my hands. I did a lot of research and I found Dr. Deuk here. And I started watching his videos and testimonials, made up my mind right there. It was without a doubt, that was my choice right there. I submitted my MRIs, and within 2 days, I did my virtual consultation with you. And 10 days later, I'm here.
Yeah.
And it's amazing. I had an appointment with an orthopedic doctor in Charlottesville, and that was February the 2nd for my first visit, just for a consultation. And who knows how long it would have gone after that.
Years.
Yes, I'm done now. It's just, I'm back to recovery.
Yeah, the problem is, unfortunately, the vast majority of doctors treating back pain don't know how to cure it. They just don't. And if I had to put a number on it, I'd say 99% do not know how to cure back pain. It really comes down to 2 things. You have to make the right diagnosis. Where is the pain coming from? Most doctors really don't even know it comes from the disc, and that's where it comes from about 90% of the time. Then the second problem is knowing how to treat it. And the treatment that works, the only treatment that works, is surgery on the herniation, really. And there's 2 surgeries that work, fusion and the Deuk laser disc repair. I've done fusions for years. I've cured people's back pain with spinal fusions, but that's a big, bloody, messy surgery with screws, rods, cages, long recovery. You're on opioid painkillers for months, like 3-6 months, just taking painkillers, just getting over the pain from the surgery. Not the back pain from the surgery. So when we started doing the laser surgery, people weren't having any back pain afterwards. They'd have just a little discomfort for one night. We realized they didn't even need the opioids anymore. So our laser patients don't get any painkillers except Tylenol and usually 1 or 2 Robaxin. So you did it. You happy you did it?
I'm very happy.
Yeah. And you can see in the surgery that we did, we actually got into your disc. We used the laser to clean up those tears at L45 and L5S1. Surgery went really well for you. We didn't have any problems. It was just a tiny Band-Aid incision on your back, and that's why you went home an hour later, and that's why you're here today, ready to go home. Where are you guys heading back to Virginia?
This afternoon.
Driving?
No,
Flying?
I'm flying.
Flying out of Orlando?
Orlando.
Awesome. Anything you want to say to your friends and family and people you know out there?
Yes, living in pain is hard. It's not a way to live. and I recommend Dr. Deuk any day.
Well, thank you. I appreciate that. You had faith, and you're going to be rewarded for that. Congratulations.
Thank you.
All right. Good to see you.